Well, good afternoon, everybody. I see it's 1 o'clock Eastern. Wanted to get started. I know we've got a fair amount of really good content to share with you. I want to say a special thank you to my partner in crime here, Matt Lamson. Matt, welcome to the meeting.
Yeah, thanks for having me.
Sure. Thank you for taking the time. I know you've been a busy guy here the last couple of weeks.
Yeah.
You know, Matt, when I logged in this morning here at my computer, it said that the last time my Mac had backed up was 44 days ago. So apparently that's how long we've been working from home.
Yeah, yeah,
It's pretty crazy. At least
yeah. It's been interesting because the start of this work from home for me was actually when I came home when I brought my new daughter home. It's coincided with that. So that's I kind of know my timeline based off of that. So it's been an interesting few weeks.
I can't resist because you just used a code word that we have not been using. We've been talking about COVID. You said coincidentally, something like that. Anyway, it's a terrible segue, but I thought I'd try. It's not a laughing matter that we're on this call today because we really are here because the change in the world with the COVID virus, coronavirus coming through has really changed what the new normal is. And Matt, you and I, as we know, working in cloud communications, it's changed our world. Even in the last 44 days plus. So we really wanted to get together and present to you guys some short form content to kind of bring you up to speed on how the world has changed, how we have this new normal, and things like telehealth, working from home, SMS, MMS usage, lots of different cloud communication topics and solutions can now be brought to bear in this time of COVID and coronavirus. So Matt, really excited to get your input and to show us some of those solutions when we get to the second half of the content. But first, I'm going to go ahead and dive in. And by the way, everybody, feel free to use the chat window there. Ask us questions in real time, and happy to answer those as we go. And Matt will jump in here as well. So let's start with this. So I took the screen capture about 40 minutes ago, and it really just showed the current situation. By the way, Matt, my favorite part of this is the lower right-hand corner, not looking at the fact that we have 843,000 cases confirmed in the U.S. We're by far the leader in that number, which is tough, which is leading us into the bottom right, which is showing how the number of daily cases has peaked and is now starting to go to the other side. And it's hard to believe, too, by the way, that it's only been since March 11th that the WHO actually declared this a pandemic. So a lot of water under the bridge over the last month plus. And it's great to see that chart, we always talk about flattening the curve, having it go down in the other direction. So really, the question is, how has this impacted things? And one of the topics, obviously, we want to talk about was telemedicine. We have a number of telemedicine companies that use thinQ as a solution, both for the voice portion of what they do, but also the SMS, the messaging that they do. And really what folks are finding out across the world, and a lot of the different countries have actually made statements about this, that they were asking the medical industries in their countries to start to lean into telemedicine as what are the mitigation efforts? And if you look at the WHO kind of text on what they asked countries to do, one of them was mitigate, which means how can we mitigate the impact of this virus that's all around us? One of the ways is obviously to have us work from home, be at home, but another way to do it is we still need to have access to medical facilities, and telemedicine allows us to stay separated but still provide that care. So things like, and by the way, we're not just talking about sort of these one-to-one visits, right? We're also talking about using kind of telemedicine for tracking and maintaining, data about the spread of the virus. And also, again, at the core of this really is, well, what you guys be thinking about how you can use the cloud or the internet to really power video and audio communications during this time. So let's continue through here. So, by the way, it wasn't that long ago that this is what we used to be used to. And when I saw this image, by the way, when I was doing the research, I'm like, ooh, that image doesn't look safe to me anymore. Talk about the new normal, right? All these people want to get back to work, and they're kind of annoyed that they're having a long wait time, but you guys are not 6 feet apart from each other in that waiting room. This is just a stock photo. But just a few months ago, this was normal. It's not anymore. So as we go into what is, obviously, this is how things have been transformed. And somebody who did have kind of flu-like symptoms back in March, this is how I connected with my primary care physician when I went through that process. It was all through telemedicine. That mask, by the way, on the right is still fairly new. I had one made for me that I use when I don't go out very often to go shopping, but it's still part of it. So telehealth really has become the new normal. And, the experts, you've seen them on the news. They really talk about kind of the potential, the global success of using virtual healthcare technology to stem or at least slow the tide of this outbreak. And they're really calling on healthcare systems, insurance payers, legislators to expand access to telemedicine technology so that, we can all do the same. And again, the CDC in their latest recommendations that they only released about 3 weeks ago said that the number one recommendation for all U.S. healthcare facilities is to integrate and use telehealth. So that's really why we're here today. So really, this ongoing crisis has, forced healthcare institutions and regulatory bodies to turn to alternative ways of providing healthcare while limiting exposure. And so telehealth really is presenting itself as the ideal solution to these woes by limiting patient, displacement to hospitals, allocating, hospital capacity to important cases, all while trying to really, mitigate the spread, of this virus. And again, guys, this is what it's all about. And I think, we've all seen this many, many times. And what's great is, again, if we looked at today's data, that it looks like we've reached or just gotten beyond the peak of the infections, right? And we want to keep this going in that downward trajectory, which is why we're having an open conversation about when is the right time to open things up. May not be yet, maybe in a couple weeks, maybe, who knows? But this is what we're all talking about. So again, the curve here really is, if we didn't take any precautions, we really didn't want to see this big spike that would have overwhelmed hospitals. What we've been trying to do is have a spike that levels off and starts to go down so that there's not a crazy impact on hospital capacity, allows people to get the care that they need when they need it, and sort of limit the other types of care that people don't need in real time, and be able to wait on those things to keep the hospital beds for people who do get sick. And again, telemedicine really does play a role in this. And in the new CDC guidelines released last week, or actually it's about 2 weeks ago now, they really said that shifting practices to triaging and assessing ill patients, including those affected by COVID-19, remotely using nurse advice lines and doctor lines and provider visits by telephone, text monitoring systems, video conferences, and other methods can really reduce exposure to ill persons with staff and minimize the surge on the facilities, right? So they want to limit staff, interactions with the disease, but also obviously take care of patients. So they really, in that statement, highlighted a couple different ways that the technology can be used to promote the increased use of telehealth, and explore alternatives to face-to-face triaging visits. They're trying to limit those as much as possible. And it really is all about fighting this pandemic, but also future pandemics. And I think I've got some data here that you're going to find interesting here in just a moment as well. It's really that, there actually was a doctor who did a study right after the Ebola outbreak in West Africa, who, and he actually is a doctor at Duke University, and he said that, telehealth really is a force multiplier that helps protects health workers and extends their reach, and should absolutely be seized upon. And obviously, we've seen the lead up to this instance that telehealth has started to gain momentum. But what you might not know is somebody who's had access to telehealth, and I've used telehealth for the last 4 or 5 years. Matt, I don't know about you. I feel like it's been a little bit more, especially, I know you have 2 younger kids. I think it's great when you have younger kids, right? You've used telemedicine?
Yeah, it's worked out really well, especially for just the simple visits and the simple things, just check-ins and that kind of stuff. Yeah, absolutely.
Absolutely. So, but what I was surprised, Matt, when I was doing my research is that, last year they did a study of folks with health insurance and asked them, how many of you have used telemedicine? It was only 1 in 10. 1 in 10. And they said less than 1% of Americans last year actually used, a telemedicine visit at any point during the year, which was surprising to me. And of course, that's all really has changed now that, now that COVID has arrived. So if we take a look here, providers and patients, since late February into March, have really been scrambling to not only find these telemedicine services, the services themselves have kind of, some of them have had trouble making sure they're properly staffed. And I know when I was coming down with the flu-like symptoms in March, I went through the first 2 sites that I booked meetings on. A doctor never showed up. They were too overwhelmed, right? So I ended up going with one that was very local here in North Carolina at the UNC system. The nurse picked right up and talked to me. So you see here are 2 fairly well-known telehealth services, PlushCare and Amwell. And both of them, Amwell just released their numbers and said that they've actually increased the number of telehealth visits through their system by 158% since January. And PlushCare says they're up 72%. So obviously the volume's up. People are finding and using these services, not only for COVID, but for other purposes. And I think it bodes well for the space going forward that this is going to be part of the new normal, having access to virtual care, having it set up and running and using it. In fact, Holly, her name's Holly Spring, she's the VP over there at Amwell, said that any technology infrastructure experiencing such a large increase in demand would experience impact. So all of these companies are experiencing a huge demand on their technology back end, as well as just usage by just by patients in general. So definitely something part of this new normal, right? In fact, and then by the way, just another really important communication channel for for healthcare communication is text messaging. And this uses the same kinds of devices, phones and tablets, laptops primarily, to receive timely reminders for appointments, both virtual and in person, at these healthcare facilities. And patient reminders is just one very well-known service that provides it. You're seeing a massive increase in usage of patient reminders using SMS and MMS. And by the way, if you add to that just password reminders and 2-factor authentication, I think you'd agree, Matt, some of the very high levels of usage of our service for SMS and MMS is to send those kinds of alerts, notifications, reminders to FA, as they say. And you've really got a recipe here for the cloud to be an important platform to power both voice and messaging, during this pandemic, and after it fades into memory and becomes part of our new normal. So that brings us to thinQ. So what does thinQ, bring to bear? Well, we deliver, flexible, cost-effective voice and messaging, MMS and SMS in the cloud for healthcare. We have over 1,200 partners in 14 different industries, telehealth being, one of our fastest growing industries, right, that use us for this. So that's what we're here to do, and that's why you're on with us. And we really have 2 different ways of implementing, and Matt's going to walk you through a couple of the features here and show you what they look like in just a couple minutes. But we really have a platform as well as APIs that make it very simple to take thinQ and add it to your existing telemedicine or really any solution that needs voice or SMS, MMS. Unlock access to 40 carriers. And a lot of our customers are saving anywhere from 40 to 70%. So it's just some of the value that we bring to you. And by the way, Matt, as you can attest, a lot of our customers, it takes roughly 10 minutes or so to get our system set up, depending on how they're set up, and start to route those calls and get those text messages flowing, which is great. So it's not something you have to totally reprogram a system to handle thinQ, right?
Yeah, absolutely. There's a handful of different ways that can be done. And the nice thing about our solution is obviously we have integrations or connections with, the other CPaaS companies that are out there, the Twilios, the SignalWires, and we'll talk more about that in a minute. Absolutely right.
Absolutely. But real quick, I wanted to show you guys just a couple examples. It's always great to put it into context for you. This is Mark Grigsby, lives out in the upper, Midwest portion of the country here. He told us a great story about one of his clients very recently was, adding thinQ to a hospital, right? And this is obviously, they offer telemedicine services, but this is primarily to add us to a phone system across multiple hospitals and care providers in this area in the upper Midwest. And really the main reason that he chose thinQ was because it was a real cost savings for this hospital network, right? Lower Umpqua is what they're called, the hospital district out there. So really, Mark, he was looking for something to help them scale better and save money to be able to take that money and put it towards patient care. So that's something where thinQ, again, we're in the cloud. As long as you have a SIP trunk, you can get connected to us through that. And we very quickly can be integrated to deliver those cost savings. And also, I mentioned earlier, unlock 40 carriers, give you redundancy. It's something you really guys should be thinking about, along with adding us to any sort of telemedicine solution that you guys are offering as well. Really to give you peace of mind that you have additional access to more than 40 carriers. You get to select which ones you turn on. And that really goes a long way towards making sure that you can mitigate outages, for your service, but also deliver high quality service with these vendors, with these carriers. And that was Matt sharing his story for that hospital network. I will say too, Matt, I love this slide too. You just mentioned that we integrate very well with Twilio, and Twilio is a great service that makes it easy to set up, your own, develop your own solutions for voice or SMS, MMS. But it gets very expensive once you get sort of beyond a basic level of usage of their service, right? And in this case, when we ran the calls that this telehealth company would have ran, they provided us with something called a CDR, a call detail record, and we ran it and said, hey, if during those last 30 days, if you had run those across thinQ instead of Twilio, you would have saved, look at that, almost $10,000, right? Yeah. So that's what this is really all about, is we can take some data about what calls you've been sending, and we can actually run your CDR through our system and say, hey, if you had run it through thinQ, run it through our cloud solution, unlock those 40 carriers, we could have delivered this level of savings to you. And it's very transparent, very straightforward. And the good news is it just gets better and better month after month. And again, with Twilio, Matt has a great video on our site we're going to share with you after this session, that it literally takes, 60 seconds to integrate us into Twilio and start routing. It's fantastic.
The nice thing is, actually, if you want to go back one quick second, we can talk about it right here.
Yeah.
The nice thing about that is we're not looking to take Twilio away, right? We love those companies. As you can see here on the right hand side, we love Signawire, Twilio, Nexmo, Plivo. We love all of these guys. They do all of the amazing features as far as creating IVRs, voice recording, transfers, conferencing. Like, they have all of these slews of tools. We're not looking to replace that. What we do is we come in at the carrier level and provide you better access to the actual phone carriers and being able to connect the calls that way. And that's where we come in with the savings.
That's right. And it's not only the fact that, we have these 40 carriers, we can get you guys this best rate through our least cost routing platform. But Matt, what I love too is that, Twilio rounds to the nearest minute for their billing. We have 6-second rounding, which is a huge cost savings for a lot of people as they scale. The more traffic you're sending, the more savings you can realize.
Absolutely. We have a lot of redundancy, the fact that when our calls come through, we add essentially up to 40 layers of redundancy with each call. You have all of those. We have some analytic tools that we are able to provide to get all the way down to see exactly every communication from that call, what carriers, what switches that call hit, how long it took for it to hop from one network to the next. You can actually put in your own custom route blocks, something that these other companies, they kind of do on your behalf, and you don't really have any insight into any of those. We provide all of that to the forefront, and we'll again show you in just a little bit.
Absolutely. Yeah. So we'll go ahead and step forward here. So again, that's implementing us with an existing solution like this. And by the way, I know, Matt, you and I were both on a conference call yesterday talking about Twilio. Yeah. And it was just fascinating to hear from a couple of folks that are in this space or providing service to telehealth companies in this space, talking about how much their traffic has increased, since mid-February, and how they're starting to look for plug-in solutions like thinQ to save money. Because they're scaling so quickly, and obviously these companies are great again when you're small, but once you start to scale, they get very expensive.
Yeah, it was something actually very interesting on that call is that they were talking about. They basically said, yes, we're using Twilio because of all the features that they have. We know it's probably the more expensive one, but we just kind of have to accept that at the moment. And so, this wasn't a thinQ call. This was actually a Twilio specific call. So we weren't really in the place to kind of chime in there, so to speak. But it was very interesting that they were very much like, look, we're having to deal with the expense right now because of the influx of calls.
Yeah, and it sounded like they were trying to find ways to improve their cost of goods so that they could make it up, going forward. And a lot of them had not figured that out yet. So, of course, I wanted to stand up and say, hey, everybody, make sure you call thinQ as soon as you're done on this call because we could solve your problem.
Everybody's contact details, yeah.
But maybe as the marketing guy, it's kind of my job, right? I got to go find those guys. I know who they are. We're coming for you. But by the way, this is a great picture, by the way, of the fact that, our voice carrier network, we're very careful about which carriers we choose to add to our platform. And we really want to make sure that we're covering, lots of countries. Obviously, international calling is not sort of the biggest slice. We do most of our business in North America, but we still do have international carriers. We handle people who need to make those international calls. But what I love about what we do is, really first and foremost is offer that network of 40 carriers, high quality, best possible price. We're updating the pricing several times a month to make sure that no matter which routes your calls take, you're getting the best possible price. So high quality, you can turn these on and off. And you already mentioned that you guys get tools. If you have some call quality issues and you know what the phone number was that you were trying to call, you can go right into our system yourself without filing a ticket, get a SIP ladder and see exactly what's going on with those calls, which carrier it is, turn them on, turn them off, pause them for a week, pause them for a month, whatever you want to do. We give you guys all that control, and that's very unique in this marketplace. None of our competitors allow that. So we also talk a lot, and maybe a lot of you on the call here, and I'm very being careful about the time here, so I'm going to go here pretty quick. But really at the core of it, we do offer voice and SMS, MMS, but really people really call us a CPaaS platform, a communication platform as a service, right? So you have both, our platform as well as our APIs where you can tie into us over the cloud, make sure that you, get access to all of our tools, route all these calls, and again, get access to both inbound and outbound, voice service, origination, and obviously SMS, MMS. So this is the core of what we do at thinQ. And again, if we real quickly just look at the cloud voice solution, I already mentioned all this, but you can customize how your calls get routed. You can make sure that calls are accurately routed per your specific needs, right? And then use our analytics tool, to get the data the way you want to make sure that those calls were delivered, make sure that you're getting the best possible prices. So very transparent, mitigating those outages, give you all the choice and control possible, whether it's for telehealth or really any of the solutions that you're trying to provide. And keep in mind too, on the toll-free side, we're the only provider as a RespOrg of a least cost routing solution for toll-free. So that's why call centers really love our solution. So they can go in and pick from our 5 high quality, toll-free carriers that, are all the names that you already know, really optimize their traffic for maximum savings, get those route updates several times a month, and make sure that you guys have, the built-in failover and the route block capabilities so that you can run really high quality, toll-free inbound and outbound voice service for your company. And again, Matt, you've been knee deep in this. One of our newest services that we started, I want to say it's about 18 months ago or so. I think, or maybe it was almost 2 years now, text messaging, right? So we make it super easy with an API to, integrate SMS, MMS to an existing solution or a solution that you're developing right now. You can even enable it on any toll-free number. We're one of the only people that do that. So we're talking SMS or MMS, so multimedia texting or just standard texting. And, Matt, primarily, our customers are basically A to P. So that's application to person for the most part. We're being integrated through that API. And people use us for everything from those patient notifications all the way through, marketing, e-commerce, alerts and notifications, two-factor authentication. That's really what it's all about. So Matt, with that, I'd love for you to give us, here we go. We've got about 10 minutes here to kind of look at the platform and, give people kind of a look under the hood of how things look on, within our platform and also our APIs.
Absolutely. So what you're looking at now is actually our inbound portal. So this is essentially what you would be able to get access to if you were to port the numbers to us, if you're looking to purchase new numbers, if you want to have your numbers on the thinQ network, so that way you can utilize inbound dialing or even the outbound dialing or even being able to utilize SMS. So as you can see here, when you first log in, you have a couple different kind of hot, quick links, if you will, as far as the configuration of the numbers or purchasing or configuring or porting your numbers. And then over on the left, obviously, you can see that there's a spot for SMS. Everything's very nice and easy to configure. Everything's set up. The nice thing about our inbound portal as well is that everything is API accessible from here. So anything that you can see through this thing, and if we want to get into subsequent demos and we can walk through, we can absolutely show all of these. But everything is API accessible, including our porting process. That's something that's actually just recently opened up within the last 6 months, I would say. It's been a great solution. What used to take quite a while as far as the porting process and a lot of paperwork and making things signed off, now we actually have an API for that takes care of all of that for the most part, and then goes from there. Go ahead.
Matt, should I go ahead and give you control with your screen? Do you want to share?
Yeah. Well, actually, yeah. I can share my screen.
There we go.
Do you see my screen?
Yep.
Awesome. Okay, great. So that was the inbound portal, and now I'm actually going to move you over to inbound portal is very straightforward, right? For the most part, it's calls come in, you can automatically configure, your numbers themselves. You can say what's been set up for CNAM, what's been set up for 911, what's been set up for SMS. You can go in here, you can purchase new, you can either, multi-configure, you can kind of go through all of that. Then you can also do some routing profiles, which is essentially how we handle inbound calls. So as you can see here, there's a couple different options. When you create something new, you have the ability where you can actually send this automatically to a DNS record. And then let's say if you want as a backup, you could actually have it go to an IP address. Let's take you one step further. What if you'd like to actually have it set up to, if for some reason these first two fail, you want to have it automatically routed to a phone number, so that way you're guaranteed that call is going to get to you eventually. So if this is some kind of, pretty bad situation if both of these systems go down, but, for the most part, you have the ability to kind of set up multiple layers for your routing profiles for inbound calls. As you can see here as kind of a little teaser, you can obviously send in inbound calls from Think numbers directly to the Twilios, to Plevos, to SignalWire, utilizing a bring your own carrier or bring your own number service that those systems offer, or that those products offer. Essentially, the numbers would be housed by us. They'd be in our network, but then we can automatically route that call directly to them, so that way you can utilize the IVRs, which are basically, the press 1 for support, press 2 for sales, or whatever the content may be, or recordings, or whatever you need for those kind of situations. You can do those. Again, SMS is very straightforward. If you have SMS currently within your own environments, it's going to be very similar. So the way that ours is set up is just being able to send, receive. You can configure your inbound locations, your outbounds, as far as delivery receipts and stuff to get content, as far as, the status of those messages, and kind of go from there. The outbound portal is very detailed, but this is kind of where we really shine with our least cost routing solution. Now, again, this is going to be for our outbound. First thing what we want to do is we want to create what's called a profile. And again, as we mentioned, you can do both international and domestic. I'll go ahead and choose a mixed option here. Some controls at the top. I'm going to skip that for a second, but I do want to scroll down and show you. These are the list of all of our carriers that we provide access to. I'm going to kind of scroll down and zoom out so that we can see. Now, as we had mentioned, we have 40 plus different carriers that we give you guys access to. Now, essentially what would end up happening is this is the equivalent as if you had a direct contract with each one of these carriers. We are kind of the person that does that for you, but when you run the traffic, it's as if you have a contract directly with them. The way that our solution works is, let's just turn on AT&T, for example, right? So you turn this on, now AT&T is active for this profile. Currently, all of your calls in this type of scenario, all of your calls will go through AT&T. Now, in your current solutions, I'm sure this is somewhat similar to what you guys may have now. All of the calls go through AT&T, but let's say you're trying to call, Lower Manhattan, which AT&T, Lower Manhattan is essentially Verizon territory, right? They kind of own that area as far as copper there. They have a larger reach as far as Verizon goes. So what ends up happening is when you make that call, it's going to go across AT&T, but then it's going to have to hop networks to go over to Verizon to utilize those copper wires. Verizon is going to charge AT&T a premium to be able to utilize their copper, and therefore you end up getting charged a little bit extra on that as well. Now, in those particular instances, let's actually turn on Verizon. So now we have an actual kind of decision logic to be made. So what ends up happening with our least cost routing solution is we are looking at not only what is the least cost to get that call completed, but we're also looking to see what's the smartest way to get those completed. Oftentimes those two actually go hand in hand. In that example of New York, it would actually be able to say Verizon is predominantly in that area. Verizon, if you go directly to the carrier that happens to own that region, it's generally going to be a cheaper call or a cheaper cost than what it would be as if it tried to go over somebody else. Now, I'm sure a question comes up is, well, why don't I just enable everyone? That way I have the best options available. The answer is almost everyone does. Now, what we do is we actually leave those disabled and we allow our customers to kind of enable, the carriers as they will, because every scenario is different, right? Every person, every company may have a different scenario. They may have had some kind of grudge with CenturyLink, or they may know something that we don't know is a particular area, or, they may know something. So they go ahead and disable those. Or let's say you're not really doing any high volume calls, right? So the short high volume calls. So you just go ahead and disable those as well. So once you have that type of solution, you can now control those via these options here, right? So we have a full LCR, which is what we talked about. We also have a cap LCR, which allows us to actually set a max rate per minute for each one of your calls. Now, the idea here is actually a fraud mitigation. What ends up happening is if, in this case, we'll say 5 cents, if any call ends up trying to reach over 5 cents, or if it's going to take over 5 cents in order per minute to try and connect that call, we're not going to connect that call. There's a lot of reasons why we do that is for, the Caribbean calls tend to be a little bit more expensive. Some of the Indian reservations tend to be a little bit more expensive. If for some reason a switch gets hacked and the calls are trying to get processed and they run a long time, this is a great fraud mitigation tool that actually ends up cutting out so many issues for customers. Once those things have been created, we can actually create what's called a trunk. Now, in this particular case, you'll select one of those profiles that we talked about, and then you'll create those. Then you'll create either a direct connect with us, and now this could go to an SBC or a switch or a PBX, whatever you have. That could be a direct connection with us. Or let's say you have one of those Twilio connects or the Signal wire. You select the Twilio option. It's immediately set up, and you're good to go. You'll be given some credentials. You change one line of code in your own environment. You're able to make those calls successfully, directly routed to us. We're able to make those calls, and Twilio still, you're still getting Twilio calls. You're still getting Twilio call IDs. According to Twilio, they're still calls from their environment. They just happen to be routed through us as far as trying to get it connected. Both parties win, and you're able to save money in the process. Now, we also talked about some diagnostics and how would you actually go about seeing these calls, right? So I've gone ahead and actually looked, I ran some test calls this morning, and we can actually query those. This may look somewhat similar to what you may have in your current environment as far as being able to see a from number, a to number. You'll see some, the billable time, which is the duration. We have total rates for those calls. What the nice thing is there are some interesting things that we provide is actually the carrier ID. Now, each one of these IDs is to a unique carrier that made that call. So you can see there's a couple different options here as far as how these calls got processed. The other nice features that we talked about, I know Tim had mentioned the SIP ladder. This is something that, those other companies that we had talked about previously, they only keep this stuff internal for their support team. They don't actually provide these out to the customers directly. A lot of it has to do with because they don't necessarily want the customers to know what networks or what carriers those calls have gone across. But we're already giving you access to all of those. We're letting you know. We're showing you, we're revealing behind the curtain as far as who the carriers that you'd be working with. It only makes sense that you'd actually be able to see from start to finish how that call got processed. What switches, what networks, what carriers, who said what. In some instances, if a carrier has to, if a call goes through and tries to connect to one carrier, that carrier declines the call, and then it has to hop to a different carrier, you want to be able to know that information, and you can see all of that here. Once you've tried to diagnose those calls, let's say some of these maybe had some call quality issues or some delays or some kind of problem, right? What you can do is you can actually look at that carrier ID. You'll get an idea of that. In most of those companies or in most of those cases, if you have to open up a escalation ticket with that, those customers or those companies would put in what's called a route block or a route change. What that is essentially they're just going to reroute the calls to a different carrier, but they don't tell you who. They don't tell you who, as far as what carrier they got rid of, what carriers the calls are going across now. They don't tell you how long that change is going to take effect. In most cases, it's probably just about a week, and then they just kind of let it die off after that. They don't give you any of that information, so to speak, right? Unless you kind of ask for it, and then you'll be lucky if you even get that information. On top of that, you don't know when they're actually going to do it. I used to work in support for 10 plus years, especially in this particular space. And when I was trying to diagnose these issues, we had to get permission from our management and upper people and from the customer to be able to try and make those changes, because we're changing the way you guys make your calls. So we had to go through a whole process in order to do all of this. And that takes time. You could be at 2 o'clock in the morning, woken up because your calls are failing. All of your calls are failing, and you don't have any insight as far as what's going on, and you're relying on somebody else to try and fix the problem. What this route blocks option does is allows you complete control of that, and you can resolve your problem in less than 15 minutes. As far as that is being able to diagnose the calls, see which calls are having problems, see what carrier the calls are going across. And in this particular case, we'll look at a call. When we run these route blocks, you'll select that profile that you were using. And let's say it seems like it's a call to a particular area code, right? The specific area code that seems to be having some issues. So what you could do is you could put in a route block. In this particular case, I'll just use an 804 area code. Now this is actually, I'll do a 919, which is our local North Carolina code. So we'll say calls to the 919 area code are all failing across, all of this one particular carrier, right? When you go through the diagnostics, you'll see the carrier ID. You can see that they're all the same carrier. So what you can do is you could say, I want to look for a route block for the 919 area code. Now, your profile that you've selected that has all of those different carriers shows up here. In this particular case, we saw, I think 48 was one of those ones that were on there. I'm going to go ahead and block that carrier. And I'm going to go ahead and say, let's just put a permanent block for now, and then I'll hit save. I've automatically changed that. What I've done is I removed CenturyLink from being able to make any calls to the 919 area code. Now I'm going to repeat that because this is very, very important for this particular thing. This is a surgical pinpoint removal of that specific area code. That specific carrier making calls to only that area code. That same carrier can continue to make calls to 804, to 310, to wherever they need to, because maybe they're not having any problems over those. Maybe it's just in the particular 919 area that they're having that issue. You've resolved your problem, 15 minutes or less. Go back to sleep. It's only 2:45. You still got some time. And, you can open up a support ticket with us. Obviously, we will handle it. We will take care of that. We will resolve the problem on, for the more permanent solution. But you've resolved your network. You've resolved your issue. You have taken care of the issue now, and you're not having to wait. We had some customers that said that they were waiting an hour plus just to get somebody on the phone at 2 o'clock in the morning.
Yeah, Matt.
That call example was a real thing. Like somebody actually had at 2 o'clock in the morning. They had took over an hour and a half to get somebody on the phone.
Well, we've had some customers, Matt, that, because I'm the guy who gets all the case studies and testimonials, who sometimes waited days. We had, when I first got hired on, somebody said I waited, 18 hours for a reply. We were down. And what they appreciated was, because we were a backup for them, which you can put thinQ in as a backup, they were able to route all the calls over, set up this routing, and they were back up and running within minutes. So they didn't hear back from their original carrier for quite a long time. So it's just one of the options that's available. And Matt, I appreciate you, giving us a look around, both the inbound and the outbound portals. I see we're right up against our time, so I want to be mindful of that. We did have a couple questions come in, Matt, and I love this one. I knew this was going to come up. Is obviously we're talking about telehealth, so obviously the HIPAA compliance comes into play. And the good thing about any sort of telecommunication provider, based on especially what we do at thinQ, there's a transport exception, right? So exemption, I should say. So it makes it very simple that, because we're not holding on to people's, personal healthcare information, we're not storing it. And even if we do have sort of very limited time access to it for diagnostic purposes, that's all covered in the HIPAA regulations, the latest set, the omnibus publication that came out a while ago, and we're covered with that. So HIPAA is not necessarily, it's not a consideration. It's something that, we have that transport exemption, right? Makes sense.
Yeah.
Another one too is, this person was asking about, they were setting up sort of a telehealth patient notification service. Matt, can you talk a little bit about sort of cost and messages per second? I think is what they're asking about. I think they're probably running up against some issues with that.
Oh yeah. So SMS is an interesting world. And what's very interesting about it, and I've been in that space for, I guess, the last 7 years, back and forth. But over my time, I've noticed that the carriers have really been trying to understand their own world and their own networks. And they've been seeing themselves SMS growing hand over fist as far as, what people are doing. And it's becoming, obviously, the primary way to communicate. I can almost guarantee, Tim, that you yourself has probably sent out at least, 10, 15 text messages today, probably?
Yeah, maybe more.
And it's only 1 o'clock? Yeah, probably even more. It's only 1 o'clock or 2 o'clock, and it's insane how many text messages come out. I'm looking at, I'm sure when I was sharing my screen, you can see I have 5 unread text messages on my phone right now. It happens. And so, with the amount of, especially in the A to P world, you can send up to, I believe it was 40 or 50 per second. And, it's like there's specific rates that you can send over an hour, as far as how many of the same message you can send per hour, as well as, how many in total per hour. There's a lot of kind of restrictions, but a lot of that's with the carriers themselves. And that's just because they're trying to protect their own network. They're trying to make sure that their own network is set up to be able to kind of handle those loads. And, we have some stuff on our website and, as far as that, and we'll make sure that we send some things out as far as the specific rates, that the carriers allow for. But yeah.
Right. By the way, Christian, great questions here. We'll absolutely send you over some more information about sort of route blocks diagnostics. We have some good, materials on that. And also, everybody on the call, by the way, I know some people came in a little late, so you will be getting a full recording of this session. I'll be sending that out probably first thing in the morning tomorrow. So if you miss anything, you didn't miss anything, because you can watch it anytime you want. I guess another question here about, no problem, Christian. There's a question here about voice service through the cloud. So I think they're kind of getting down to brass tacks of, how easy is it to add something like this to an existing phone system? And really, Matt, it comes down to, if you're using SIP trunking, you're good to go. That's really the foundation, right?
Yep, absolutely. Yeah, it's very, very easy. It's just a matter of you adding in a couple IP addresses, and then you're automatically routing the calls over to them. Or routing all the calls to us. And it's very, very easy. And even the Twilio, the Connects, those are even easier, because it's, the way that our solution works is so simplistic. It could easily take as simple as a single line of code.
That's right. I've seen you do it. I've been on the call when you've helped people do it. It's amazing. By the end of the day, they're sending traffic. The quality goes up. They're able to send a whole lot of more calls. You didn't have to add any hardware, software. I mean, Twilio was notorious for charging thousands of dollars to go from 2 calls per second to 5 to 10. It's really expensive to do that. We don't charge anything extra to get to that level with thinQ, with one code change. So, sorry, now I feel like I'm being more of a salesperson than a marketing person, but it's true, because a lot of people don't.
It's true.
Yeah, it is. It's absolutely true. And we've seen it happen. We got some good case studies. So by the way, guys, we do have documentation. Really recommend you guys go over to thinQ.com, thinQ.com. Take a look under that solutions pull down. And obviously, if you really want to go in depth, Matt, as well as our solutions team, can get on the phone with you for a personal kind of one-on-one 30-minute call, which is what they tend to be. Because we want to hear more about what you're doing. What's your solution? Are you in telehealth? Are you just, are you a VoIP provider? And is there a fit for something like thinQ, a cloud communication, this new normal in your setup to help you not only save money, provide higher quality calls, and, by the way, have access to, we haven't even talked about, service here, Matt, but we have a fantastic live, support team that always gets 5 stars and kudos for being available, allowing you to, get service when you need it. We use Slack a lot. We have all these different, real-time communication tools. People are surprised when they pick up the phone and they call and somebody actually answers and we respond very quickly. But you don't want to be surprised with thinQ, because that's just the way that we operate. So, that's what we want to be for you guys.
The nice thing too is that when you call, you're able to pretty much get the same person. That's something that I've had when I've had my own personal experiences of trying to call a carrier, and I've run into the thing where I call and then something happens, I have to call back, I can never get that same person again. And I have to start over from the beginning, try and go through the same troubleshooting issues and try and go through the whole thing. You're able to get the right person. You're able to get the same person even, to continue on the conversation we had previously, from the support team to our customer success, everybody.
That's right. Well, Matt, I want to stay here. So we're right up here. It's about quarter of. So we went over just a little bit, but some really good questions. And again, want to recommend everybody here, if you want to get access to Matt, if you want to have your own demo with our solutions team, go over to thinQ.com, click that, get a demo button. We're happy to have that conversation. And again, we want to consult with you. We're not going to hard sell you on anything. We just really want to know what kinds of things are you trying to solve for. Maybe it's scaling. Maybe it's your telehealth system is experiencing a great increase in traffic, both for voice or, SMS, MMS. And how can thinQ fit into your existing, infrastructure with minimum changes to help you save money and get higher quality calls and deliver more text messages? That's really what we're here to do. So we all know that telemedicine is not going away. Remember I said at the beginning that only 1 out of 10 Americans had a telehealth experience last year. That's tremendously increased in real time in the last month or so. And, having somebody like thinQ to be your communication provider in the cloud can really help you scale, save money on your cost of goods, and continue to make a healthy profit from a telemedicine type environment, or really any other solution you're trying to provide. So Matt, thanks again for your time. I know you've got a call coming up here pretty quick. Yep. I'm glad I got a chance to do that. And by the way, guys, when you registered for this webinar, you also registered for the other, I think it's 3 webinars in this series. So we'll potentially see you guys again next Thursday for another sort of new normal look at how the world has changed since coronavirus kind of hit the world, and how thinQ can really help solve those problems and really be a solution provider. So with that, Matt, thank you.
Thank you very much.
Thank you, everybody, and we'll talk to you real soon. And again, I'll be sending out this recording here on the next couple hours, and would love your questions. And again, thinQ.com, thinQ.com. We're always there to help. Thanks, guys. Have a great day.